Yes, greetings to you. Hopefully everyone is doing well. I want to welcome you to tonight's show. That is the health topical discussion at Home-Based Medical Services Television, Talking Health. That is HBMS, every Tuesday and Fridays. That is in the night. We come live to you at the comfort of your sitting room to discuss something very vital about your health. And this week, our focus has been put on a medical emergency that people don't take serious, yet it has taken very, very many people's lives. And that is stroke. I'm privileged to have been hosted to this TV channel, and I'm going to be discussing about stroke. We will be looking at a few things here and there, what it means, the signs and symptoms. We'll look at its causes, but more importantly, we'll also look at the non-pharmacological measures that you can take to prevent stroke. Stroke is a medical emergency. And not forgetting the sponsors of these wonderful shows. One is the director, Nutritional Institute of Nursing and Midwifery, Mr. Chintu John. I want to thank you very much for always sponsoring these programs. The other sponsor is the Visionaries International team. And I want to bring you to your notice that we are planning something very, very big. That is the coming month. On the 22nd, we are organizing an event that will move mountains. And I want to encourage all team members of the Visionaries International to be part of this wonderful event. I also want to send greetings to our other sponsor. That is the Elenovats team. I want to thank you very much for all you're doing to make sure that we can have such programs running. But more importantly, this show is also proudly sponsored by Vidamax. Vidamax is a cardiovascular food supplement that me and you need to live a healthier life. As we go on in today's discussion, I'll be expounding more about this product. It's called Vidamax. Not forgetting all our partners, particularly from Southern Africa. Thank you for always that you do to make sure that we can have a smooth running of everything that we are doing as HBMS TV. Also send greetings to people in the Middle East. I have my friend in the Middle East, that is Angela. I send you greetings. And very many other friends. I also send greetings to people in the UK. Greetings to Mr. Mugwanya Jude. Thank you very much for all that you're doing to make sure that people in Buganda Kingdom can live a healthier life. We always see your input. It is very awesome. Then I want to send greetings to Madame Siko Ndebele. She's also based in the UK. However, she comes from South Africa. I want to say hi to you. And in the next few minutes, we are going to be getting into our health topical discussion for tonight, and that is stroke. So straight away, we will get to the discussion. And thank you very much for hosting me at HBMS TV, Talking Health. Straight away, as we get into our discussion, I want to bring you to your notice that the most vital organ that you can ever take care of in your life is your brain. Yes, that brain, that is how it is made up. We have the left hemisphere, we have the right hemisphere, we have different cells in the brain. But I want to tell you that anything that happens in your body is fully coordinated by the brain. Even if you're exchanging blows, the brain must have accepted that you're going to do that action. Even if you're responding to someone, the brain has a very important role that it plays. And I want to bring it to your notice that it also coordinates the central nervous system, which is very, very vital. But for our discussion today, our focus is about stroke. You who is following us at HBMS TV, I want to define for you what stroke is. I want to tell you that stroke is an acute brain injury caused by either decreased blood supply or hemorrhage. In brackets, you can call it loss of blood to the brain, but at times, stroke can be as a result of both. As we go on, we will be seeing several causes that can lead to decreased blood supply to the brain, or even hemorrhage, you lose blood. We will be looking at that. And I want to bring it to your notice that stroke is a medical emergency that can cause permanent damage to the central nervous system. I had earlier talked about that, and can result into death if not diagnosed and treated early. Or it can even result into a permanent damage. Very many people are victims of stroke and all that. So I want to tell you that among the major or the common types of stroke, we have what we call the ischemic stroke, blockage and no supply of blood. Let me say in the arteries in the brain, there is a blockage. We will be looking at the causes. Then the other one is hemorrhagic stroke. When you talk about hemorrhagic stroke, this is as a result of excessive loss of blood. You may have been involved in a motor accident, and at the end of the day, you have reduced blood in the body, so it can also result into stroke. So more importantly, when you look at the major types, yes, we have another type, but my focus for today, I felt it important to focus on the major two types of stroke. When you look there, that is what we call the ischemic stroke, which results from blockage. It could be a clot, that is very common. You know, very many things result into blood clots, so that could result into stroke. Then there is also a condition called anoxia. All these may result as a blockage. Then the other type that you can also look at is what we call the hemorrhagic stroke. Hemorrhage is to do with blood, and at the moment, let me say, there is a rupture of a blood vessel in the brain, and blood is out of its proper channels of movement. You can end up having what we call hemorrhagic stroke. And I felt it important, you who is following us today. I was earlier discussing with a friend from the UK, that is Eddie, and he was telling me he's in love what we share at HBMS TV. And I told him that tonight we will be talking about stroke. And he was like, what are the signs, what are the symptoms of stroke? So allow me share with you a few things, but I want also to bring you to your notice that once you have these signs, it's not conclusive that you have stroke. However, you know, Africans, we are strong. You can even have a few signs and symptoms here and there, but you recover by God's grace. That is why I always tell people that diseases don't read books, simply because I've seen very many victims recovering. So these are some of the signs and symptoms. For example, sudden onset of weakness or numbness of the face, the arm, or the leg. It could be an early warning sign of stroke, and at times when you do the needful, you recover from it. Then the other one is sudden lack of coordination of the limbs. You tell somebody to raise up their arms, they cannot raise them at once. One arm is weak and then the other one is strong and all that uncoordination. Then we can also look at the sudden vision loss or blood and double vision. I always tell people, split eyes, that if you have vision that is not clear out of the blue, it could be a sign of stroke. Then there is what we call sudden difficulty in speaking, somebody who has been talking comfortably, we've been discussing comfortably, out of the blue somebody cannot. That can also be a sign of stroke. Then severe dizziness, then loss of body balance, out of the blue somebody falls down. Very many people have passed on as a result of stroke. They fall in the bathrooms. I'll be discussing with you how that comes all about. But very many people fall in the bathroom, they lose balance, and at the end of the day, they have any type of stroke. It could be a blockage, it could be, but more importantly, in the bathroom, it is to do with hemorrhagic stroke. That is what is very common. Then you have severe headache that is sudden. It can also be a sign. So you who is following us at HBMS TV tonight, in case you have any questions, you can keep them coming. I'll be answering them. I want to make this very brief, such that people who want to go for weekend can go. People who want to rest can rest. We always have this late in the night. So these are some signs, spot the signs of stroke first aid. They say during a stroke, every minute counts. You depriving of your brain of oxygen or blood for only 3 minutes, it can result into dead cells of the brain. So they are telling us that you could save a life by recognizing these signs of stroke as early as possible. Number one, when you call the acronym of first, the face, you need to ask the person to smile at you. Is one side of the face dropping? Somebody cannot comfortably blink the eye, cannot comfortably move the jaws, they cannot smile at you comfortably. It could be an early warning sign of stroke. Then the other one is the arms. Ask the person to raise their arms. Is one arm weak? Somebody cannot comfortably raise them at once. You find that in one or the other, it could be a sign. Then the other one is speech. Ask the person to speak. Is their speech slurred? They cannot speak comfortably. All these are signs and symptoms. And they are telling us that the moment you see any of those, time is very paramount. In those developed countries, they will call 911 right away at the first sign of stroke. Here in Africa, you may need to call your doctor, you may need to call your physician, you may need to call anyone who is responsible for your health the moment you see any of those signs. So the common causes that you need to look at, you is following. We need to look at what we call the blood clot, embolism from a distant site. It does not mean that obviously the blood clot has to be in the brain. It can be at a distance from the brain along your body. You all know we have a network of blood vessels within our bodies. Then talk about the cardioembolic stroke. This is to do with your heart, and it accounts for 20 to 25% of all strokes that happen. Then talk about cerebral hemorrhage, that is bleeding within the brain. Then clotting within the artery, thrombosis, that is also a common cause. And when you look at the types, I had not talked about the third type, the atherosclerosis, where blood vessels branch into more abnormal blood branches and diverting the blood flow to the brain. That can also result into stroke. So I also wanted to discuss something about the risk factors. What are some of the things that you need to take care of, things that you need to look at so that you do not fall a victim of stroke unknowingly? Number one, stroke is very common in people who are hypertension, high blood pressure. In one or the other, it can result into blockage of the blood vessels, including those in the brain, and at the end of the day, you can have stroke. So it's a risk factor. If you are hypertensive in one or the other, at one day, you can develop stroke. Then the other one is cigarette smoking. When you look at the contents of what is in cigarette, puts you at risk of developing stroke. Then the other one is excessive alcohol use. I'm sure you've seen very many people getting into hypotension, falling down after drinking. All this puts you also at risk of developing stroke. Then the other factor that you can also look at is undesirable blood cholesterol level. The moment you have a lot of abnormal cholesterol in your body, you're going to end up developing stroke. We can talk about diabetes mellitus, both type 1 and type 2. Then talk about obesity, talk about the old age, talk about cancers. You remember, cancer is as simple as the abnormal growth of body cells, different cells in the body, but even blood is a cell, blood are cells. Then I've talked about diabetes, I've talked about factors of smoking, obesity, heart attacks, lung cancers, different things. So I want to bring it to your notice that you is following us today. There are non-pharmacological measures. Yes, when it comes to pharmacology or when it comes to medicine, I would advise you go to hospital for checkups and all that. But more importantly, there are things that you need to do if you want to live a healthier life and also prevent stroke. When we look at the non-pharmacological measures, we need to look at ensuring adequate oxygenation. I don't want you to fall a victim of somebody who lives in a house and inside the room where you live, you end up cooking inside there. Obviously, oxygen is burnt out. One day or one time, you can fall a victim of stroke. Simply because as long as there is no adequate oxygenation in one or the other, the body is affected. Living in small houses is also a problem. Then the other one, you need to ensure adequate fluid intake and electrolyte balance. Always make it part of you to keep taking water again and again, drinks that are going to help you have enough blood in your body, that are going to help you balance your electrolytes and all that. Then the other one is physiotherapy should be started as soon as possible. If one is already a victim, if you're not yet a victim, I would encourage you to do regular exercises. But if one, let me say, has hypertension, before you start them on physiotherapy, it is very important that you consider their blood pressure becoming normal first, then you pick it from there. Then the other one is natural blood thinners are very, very vital. We will be talking about that further as we go on. Then manage secondary causes of stroke. We saw the risk factors. Those could be the secondary causes. So you need to manage them adequately. Then advise to stop smoking if one does. Then regular exercises, make it a point. As long as you do not do vigorous, do slight exercises to keep you in shape, to make sure blood can flow in your body very well. All these are very, very important steps. But more importantly, you is following us at HBMS TV. I want us to discuss something very right about the role of nutritional supplements in stroke. What are nutritional supplements? These are forms of beverages, forms of capsules, which are natural, that do give you what you miss on your plate. That is what we call nutritional supplements. So when we talk about nutrition and rehabilitation, are crucial in post-stroke recovery, especially in the elderly. As you grow in age, you just need to know that nutrition does a very, very important role. And I want to tell you that since stroke is the leading cause of long-term disability, I've seen people becoming disabled because of stroke, there is a need to promote special individually tailored nutritional strategies targeting older patients with low motor ability. The moment you start suspecting them, draw a nutritional strategy for such people so that you can help them out. Then the other one is chronic stroke survivors have higher risk of developing nutrition-related chronic diseases such as sarcopenia. Sarcopenia is a disorder of the muscles, loss of mass in the muscles, and then you end up getting that condition. You can also talk about anemia, less blood, then talk about type 2 diabetes, mellitus, and osteoporosis. All these are conditions that are very common post-stroke. Moreover, reduced motor activity, cognitive impairment, and depression might be aggravated by poor malnutrition status. So unless you do something about it, stroke may become a permanent disability. And they're telling us that accumulated data, and this is according to research, data suggests that nutritional supplements and neuroprotective diets can be associated with the better effectiveness post-stroke rehabilitation, as well as the brain recovery. As long as you do that, your brain is going to recover very well and at a very good speed. And they even go ahead to tell us that nutritional supplements and neuroprotective diets have an impact on functional recovery during and after rehabilitation of people who have had stroke. So you need to take these things serious. And they're telling us that, moreover, a new approach of antioxidants and anti-inflammatory properties in most food supplements have shown a greater impact in preventing stroke and reversing its complications after stroke. We have products like Vidamax. Vidamax is a cardiovascular food supplement that is going to give you a healthy heart, a healthy blood saturation, a healthy body. More importantly, something I need to tell the men who are following us, that it also works on your sexual vitality 100%. Because as long as the blood is flowing comfortably, you can even perform your marital duties very, very well. Then I want to talk about C24/7. I want to tell you that in the management or prevention of stroke, amino acids are very, very vital for your muscle build-up and all that. Then the other one is vitamin D. But when you look at C24/7, C24/7 has over 22,000 phytonutrients. When you talk about electrolytes in the body, it can balance them very well. But more importantly, there are 18 amino acids, and then the vitamin D. Over 29 vitamins, minerals, and trace minerals that you need in your body to live a healthier life. Then talk about the living alkaline decaffeinated coffee. Wow! Balancing your electrolytes, doing away with sugar, and most so, these products or the living alkaline decaffeinated coffee cleanses and detoxifies the body. It even works on sexual vitality in both men and women. And more importantly, the other product is what we call the cholejuice. Cholejuice is a cholesterol reducer, omega-3 fish oil, combined with vitamin E plus DHA, which is food for the brain. So it is very healthy for your brain. But more importantly, it also plays an important role when it comes to issues of undesirable cholesterol levels. So it is very, very vital, even in people who have hypertension. Then Restore Life, typical anti-aging formula with very many ingredients that are going to help you prevent all complications that come with age. And I want to talk about the major components in post-stroke rehabilitation. They tell us that the impact of nutritional supplements on post-stroke rehabilitation, nutritional supplements are recommended in patients who are undergoing rehabilitation very often due to the higher demand of bioactive compounds during the complex process of recovery. The number one thing you need to consider is the amino acid supplementation. Right from C24/7 with Complete, which have over 18 amino acids. Amino acid supplementation seems to be a very important factor in the prevention of muscle protein hypercatabolism that often occurs after stroke. Rehabilitation in combination with amino acid supplementation can contribute to the improvement of the muscle mass and functional efficiency in early post-stroke phase. I want to tell you that patients without essential amino acid supplementation continue to lose muscle mass even 2 months after stroke. You keep losing weight and all that. I'm sure you've seen this very common in people. Their musculoskeletal system is affected. Then the other component that you need is what we call the vitamin D supplementation. Very common, over 29 vitamins and minerals in C24/7 and Complete. And I want to tell you that vitamin D deficiency is a common problem among stroke survivors, and it is associated with decreased muscle strength, balance, and physical performance as long as you have a deficiency of vitamin D. And studies on the effect of vitamin D supplementation on post-stroke rehabilitation indicate its potential to support functions of the nervous system and enhance the rehabilitation process, and that is according to Seattle et al. These are studies that have been carried out. So you who is following us, as long as you get vitamin D in your body, you're on the right track. We have wonderful supplements where you need to talk to the person who might have connected you to this channel, or you come back to us in case you have questions to know about the dosages and all that. But I also want to bring it to your notice that as you're using these natural sources of vitamin D plus the supplementation that we are talking about, I want you also to know the symptoms of too much vitamin D in your body. I want you to look at dizziness, appetite loss, thirsty, headaches, fatigue, and nausea. As long as you have a lot of vitamin D in your body, that can happen. But I want to thank you very much for always following us at HBMS TV Talking Health. But I want to tell you that your focus should be put on prevention and managing the risk factors and secondary causes of stroke. And when you meet anyone, in case one is on treatment, encourage them to continue plus physiotherapy alongside the nutritional supplements. The information we share with you here is general information. It is not designed to replace any medical advice. We just help educate you on how to live a healthier life. That is our focus. That is why our focus is on non-pharmacological measures to help you live a healthier life alongside food supplements. As I come to the end of tonight's show, I want to pass a vote of thanks once again to our sponsors. That is Mitiana Institute of Nursing and Midwifery. Thank you for always endeavoring to make sure that we have these programs running. I also send a vote of thanks to the Visionaries team. I also send a vote of thanks to the Elinovats team, and more importantly, to the directors of home-based medical services, Television. More importantly, I also want to send a vote of thanks to one of our presenters, our favorite host, that is Madam Alice Nuts, who hosts our talk show every Monday to Friday, and that is Your Life Today. Thank you for always endeavoring. But I also want to send special thanks to different partners, Madam Nasuna Karo, Mr. Cedric Peter Kategaya, Mr. Brian Sendagile, Madam Susan from Zimbabwe, Mr. Jude from the UK. I want to send greetings to Madam Teke from Zimbabwe. Then I have Tandue, I have Engineer John Paul. I salute you all and thank you very much. May God bless you. Have a blessed night and a blessed weekend. Not forgetting our news anchor, that is Mr. Mwanje Victor, who always gives us every Saturday afternoon. He gives us medical news. Mr. Mwanje Victor, I salute you and have a blessed night. Home-based medical services television, talking health.